having 40,000+ new cases a day. I would not be surprised if we go up to 100,000 a day if this does not turn around. And so I am very concerned.
Can you make any kind of estimate on what we're looking at overall on the number of deaths before this is over? You made an estimate back in March between 100,000 and 200,000, but we have a lot more information now, and we're already at 126,000 deaths.
Right. I can't make a estimation because that would have to be modeled out, because when models are done, and that's where those original numbers came from, Senator. As I've said very often, models are as good as the assumptions that you put into the model, and those assumptions often change depending upon what your response is. So I would really be hesitant to give a number that will come back and either be contradicted and overblown or underblown. But I think it's important to tell you and the American public that I'm very concerned because it could get very bad.
All right, I appreciate that, Dr. Fauci. Look, we all want our economy
well over time,
to recover.
Senator Warren.
I just like the same time that my Republican colleagues got, because I want to say
All
that
right,
we all want our economy
time
to
is
recover,
up, Senator
but
Warren.
we can't keep pretending.
Senator Warren. Now, I'm being just as
that
fair to you as I was to
Republican
Senator Sanders.
Colleagues got a lot more time.
Senator Warren,
Chairman,
I always treat you fairly, and I would appreciate your respecting the chairman's rules. If you'd like to make a closing statement, go ahead and do it. But I don't appreciate your questioning the fairness in presiding over the hearing.
I was under the understanding, based on what others had done, that you were allowing more time since we had such important witnesses.
Well, when you're chairman, you can make that, you can make those decisions.
Thank you. You know, I just want to make the point that we can't keep pretending this virus is getting better when it isn't. That's how we end up with messes like the situation in Texas. Racing to reopen too soon, then scrambling to close down before the hospitals get completely overwhelmed. If we don't get our act together, this is our future. Seesawing back and forth between too few restrictions and then exploding cases and repeated shutdowns. In this future, thousands more Americans will die and our economy will be brought to its knees. We've got to have a national strategy that makes testing available to every school, every business, every hospital, every church, anywhere that Americans come together. We need to expand contact tracing, and we need leaders, starting with President Trump, who have enough backbone to face reality, distribute our resources, set our standards, and stick to them. Because if we don't, the result is going to be more economic wreckage and more death. Thank you, Mr. Chairman.
Thank you, Senator Warren. What I've tried to do in this hearing is to ask senators to stay within 5 minutes and the answers within 5 minutes. And if the answers go beyond that, I've tried to be respectful of that. But I would ask senators not to ask their questions into well past 5 minutes and then expect to make a speech at the end. Senator Scott.
Thank you, Mr. Chairman, and I will certainly respect your time limits. I think we all should do that. And frankly, as we were asking Dr. Fauci for an estimate of how many lives may be lost, I recall the first estimates were between 1 and 2.4 million lives. So I'm certainly glad that we are not there. And perhaps one of the reasons why we should be thankful for where we are now and force ourselves to have a serious conversation about continuing to flatten the curve is because the all hands on deck approach is effective. We just need as much cooperation from as many people as conceivably possible in every state around the country in order for us to see these numbers continue to make a dive in the right direction as opposed to spike in the wrong direction. And I think about the Operations Warp Speed along with the crucial support from BARDA and other federal agencies, public-private partnerships, and accelerating groundbreaking technologies that could eradicate COVID-19 and revolutionize, frankly, the vaccine development landscape. Because of these efforts by industry, academia, and government working in concert, we could see a viable candidate or candidates in a matter of months for a vaccine. And because of a growing number of large-scale manufacturing agreements with companies like Moderna, Pfizer, and J&J producing hundreds of millions of doses at risk, which means in advance, we are already working to address issues of access. And this is critical, especially for our most distressed communities. That said, effective development and widespread access, while essential, are only part of the equation. If and when, and I feel optimistic that it's when and not if, we get a viable vaccine, we need to encourage folks to choose to get vaccinated. I was really concerned when I saw a recent AP survey that showed that only 49% of American adults plan to get vaccinated once the COVID-19 vaccine came to market. A full 20% said that they did not plan to get vaccinated, and 1/3 of Americans were not sure. Given the public's recent and vital focus on health disparities, it's worth noting that among certain groups, these figures are even more alarming. Just 25% of Black Americans, 37% of Hispanic Americans plan to get vaccinated against the coronavirus. My question to the full panel, what steps can we take at every level of government and in the private sector with healthcare providers to ensure a proactive education campaign and outreach strategy on the importance of getting vaccinated, both for COVID-19 and frankly, even more broadly?
I'll take a shot at it first, Senator. As I mentioned in response to another question, that we have a community engagement program that actually operates out of Operation Warp Speed, the vaccine development program component of that. Also, there needs to be engagement of people who the community trusts, particularly individuals who are noted sports figures or whomever. When we were involved and continue to be involved in community engagement with HIV, we used people in the community, boots on the ground, to go out who looked and lived and are like the people they're trying to engage. It's very critical because I share with you the concern that we get to the hoop and we get through it of getting a safe and effective vaccine, only to find that a substantial proportion of the population do not want to get vaccinated. Of particular concern is it's that proportion of the population that generally are the most vulnerable in the sense of the minority communities, African Americans, Latinx, Native Americans, who in fact, because of underlying conditions, make it more likely that if they do get infected, they would have a poor outcome. So it's extremely important to engage them at the local level. Thank you.
Well, thank you very much for your answer, Dr. Fauci. Let me just close with my 40 seconds that I have left, respecting the time, and I hope that we continue to do so. The pandemic has triggered a drop of 60 to 80% of immunization rates among children. And even now that states are reopening, we're not seeing the rebound in these rates that are necessary. This creates a real risk of secondary infections and disease outbreaks that are not on the general public's radar as we reckon with the chief crisis at hand. So I think it's incredibly important that we follow your strategy, Dr. Fauci, as it relates to engaging community leaders and perhaps people with notoriety to challenge us to get involved in taking the vaccines. Thank you, Mr. Chairman. I apologize for being 4 seconds over my time.